Do you think India does the science of tomorrow? Do you think those people who are doing the science of tomorrow want to partner with you? So how does academic industry partnership look to you? How do you offer things to the growing startup network here?
I do think we have not unlocked that potential and that investment that we've made in the higher educational system. We have an incredible pool of talent sitting in there that can do extremely impactful work.
So you have a lot of innovators right now in India that are trying to create startups. They are sitting in academia, they're sitting in incubators, and they're building these small startups that will scale. Some of you have actually really scaled significantly, but most of you haven't. And I worry about this pipeline jam that you would have if a vast majority of these companies do not scale.
I don't think that we are doing enough cutting-edge work. I think we are satisfied with low-hanging fruit. Is that we are incredibly nervous about failure. And that failure in academia, failure as an entrepreneur, it's something that we are socially not geared to face.
There's always risk versus reward, graph, and I think a lot more needs to develop from an ecosystem standpoint. But can we build wonderful deep-sized prototypes? Yes, yes, yes. Okay. How does it scale? A lot more to be done.
I think everybody around us and the fact that we have this very good complementary skill sets between the co-founders is what actually helps us think much larger than any of us could have individually.
First, thank you for coming. This is about medtech, and I'm not going to introduce each one of them. The operative words of this is written right there: scale and impact. If you were to come here 15 years back, like I started, and BTS is very close to me because my journey in India, as a professional journey in India, started here. You would possibly struggle to find many medtech companies. But now there are many, hundreds of them. Many of them are possibly at the cusp of growth. Some of them have grown incredibly well. Just recently, last month, you heard $65 million being invested in Cure AI. So we're going to deliberate on what would it take for us to really leapfrog, pole vault, all those wonderful adjectives, to be really at the high table of medical innovation, medtech innovation in the world. And look at the array of leaders that we have. All of them are very well known. Two of them have seen it all in the last 30, 40 years, stalwarts. Two of them are building AI companies in the last 7, 10 years. And we have a wonderful panelist all the way from Stanford here. So let me start right from my left, Professor Anurag Mairal from Stanford, then Professor Vijay Chandru from Strand Life Sciences and many other things, Laina Emmanuel from BrainSight AI, Chandrasekhar Nair, whom we lovingly call Chandy, my current boss. Prof. Chandru was my previous boss, from Bigtec and Molbio, and of course Geeta Manjunath from Niramai. So a big round of applause for them. We've got an hour. It so happens that Professor Chandru, this is his last year as the chair of the biotech and health tech vertical for BTS. It's his swan song. He has seen it all. The way we have designed this program is 10 to 15 minutes of lead talk by Professor Chandru. After Vijay speaks, I'll again take over. We'll do a 25 minutes of Guftagu for David. Guftagu means, talking amongst friends. And then after that, obviously, we'll open up to you. So without losing much time, Vijay?
Thank you very much. I mean, it's been incredible to be, of course, part of this whole conference and run the BioTrack for, I think, about 8 years now. And so it's time to hand off. But, I'm going to focus on the democratization of genomics, right? And I think David talked a little bit about this yesterday in the context of experimental man and so forth, and super convergence. But I'll focus on my own journey, and I think if some of you might notice in the background there is the Constitution of India. We are just about to celebrate the 75th year of the Constitution being signed on the 26th of November. And I think part of the draw of, there are two grandsons of people who drafted the Constitution in this room today. And I think one of the reasons why we probably came back to India was that there was this draw that we had to come back and do something, right? So my journey into biotechnology actually starts with stepping out of the ivory tower, right? And the person who held the door open so we could step out of the ivory tower was Mr. Ratan Tata. And, Mr. Tata actually was the president of the court of the Indian Institute of Science and said, why aren't there faculty-driven startups here? Like I see at Stanford, at MIT, and so forth. So that night we wrote to the director saying that, well, we're ready. We have a lab that's pretty translational called the Perceptual Computing Lab. And we have technologies that we'd like to take out. What's the process? So the director said, we don't have one, but I'll appoint a committee. And so the committee started looking at this in 1998. It took us 2 years to actually get the companies going. But by 2000, we were up and running. And we built two companies. I won't talk much about one of them, which was to make the handheld Simputer, which was to try to democratize computing in India. But if you want to know more, go to Science Gallery, Bangalore. There's an exhibit on the Simputer, and you can find out more about it. So that was the impact. I think we introduced the meme of mobile computing and handhelds in India in 2001. Okay, so this was 6 years before the iPhone. And in fact, if you think about it, the iPhone has never won a lawsuit against Samsung because Samsung always says there was prior art, right? So I think it's, so impact-wise, I think it was an important development. And then, of course, there's Strand, and Strand is what I'll really talk about, but I did want to acknowledge the Gang of Four, right? And we are sometimes called the audacious Gang of Four, because, I think this type of journey, pioneering sort of journey in academic entrepreneurship in India could not have, would have been much more difficult to do alone, right? But when you do it, with a gang of four, it becomes a lot easier. And amazing guys, just the kinds of things that they can do. So Strand. Strand actually is India's first AI company. Not many people know this, right? Actually, we were all machine learning guys. And we realized that biology was going through its fourth paradigm, and it just needed better data analytics. And as we used to say, biology is too important to be left to biologists, right? So sorry about that, but it's so we actually went about building the tools. The physical sciences had MATLAB, but the life sciences didn't have anything like that, right? So we realized that exploratory data analysis, machine learning, these were actually the platforms that were needed by biology. So we started building those, and actually, Agilent and Illumina and Strategene and all these companies essentially picked up our tools and packaged them and sold them. So impact-wise, this actually has over 35,000 citations because of, essentially became the gold standard tools for molecular biologists who were working on annotating the genome and various things. So a different type of impact, but we were a small, profitable company. So I think comfortably running out of Bangalore and having that impact. So I'll try to go faster. We then decide to get into personalized medicine. And to do that, we actually first build a whole AI platform called Ramanujan. I think we flashed through that. But just, to point out that we came up with a name Ramanujan because we were a little tired of IBM's pushing Watson, right? So we said, there's something actually even better that has been built for biology, right? And but then things started getting really interesting in genomics, right? The cost of genome sequencing was growing at the square of Moore's law, right? In a sense, the costs were dropping even faster than Moore's law. And Moore's law is a straight line on that graph. And so it was staying with Moore's law till next-gen sequencing became available. And once next-gen sequencing came, it sort of dropped fast. And today, at Strand, we have a NovaSeq X Plus, which is capable of running about sequencing 65 whole human genomes in one night, right? And so this is the point where we could start thinking about real scale, right? So first informatics, then diagnostics, impact in precision medicine, and then finally now ready to scale because democratization has happened. Oops, these are going a little faster than they should. But at this point, Mr. Mukesh Ambani approached us and said, I want to democratize genomics, and will you be the company, right, to do that, to take that forward? So, of course, this was an incredible opportunity, and we could see the cost of sequencing going down to $1 per gigabase, and we said that this is the time to really scale. So we signed up, and just to point out that the day the acquisition of Strand was announced in the markets, Reliance saw an uptick of 3.83% in its share values, right? Now, the point I want to make here is, of course, I want to claim that IISc actually created a deep tech unicorn, which IISc will never claim, but it's part of the IISc culture to not make such claims. But the fact is that when you develop these deep technologies and you embed them in a commercial partner is when the value really comes out, right? I think it's very hard to think of even the gang of four to be able to do the full commercialization. And I can see Chandy nodding, and so hopefully he will corroborate this. But that is really the moral of the story, right? I think we have to keep creating these deep tech and technologies and innovations, and then for real impact, we have to embed them with commercial partners. And I think that's what I hope will happen, because that's the only way we're going to get rich before we get poor, right? It's a real challenge. I think Viksit Bharat is not going to happen unless we really think about how we get this type of innovation into commercial space. For some reason, it's refusing to forward. Okay, there we go. So I'm going to switch to the second story very quickly, very short story here, but I hope it will start. Anyway, so yeah, right. So everyone knows of CRISPR as cleavage, and there you actually see a real cleavage happening. Electron microscopy actually photographing the break that is made by CRISPR, and this it's done 2 or 3 times just to show you that it can happen in seconds. It can take up to a minute, but it happens. And look at this last version. Last one will take about 20 seconds, I think. There, right? And but there's also something else that happens in CRISPR, and that's called transcleavage, right? And for that you use slightly different enzymes, the Cas12 and the Cas13, and I don't know this. There we go. Oh, sorry, it was starting, but it stopped. Yeah, there we go. And the video is not important. It's a cartoon which actually shows that after it does cleavage of one of the strands, then it becomes like a Pac-Man. Any reporter, any nucleic material will get cleaved on that Cas. So then you can have reporters with fluorescence and you can read out. But the thing is that the first match has happened with the CRISPR guide, so you've detected that pattern in the sample, right? And so that leads to a detection mechanism. Of course, Sherlock, Mammoth, and in India, I think Feluda, all of these tried to use this to build a diagnostic kit. PathCrisp is the platform that we're building at CRISPR Bits for doing this. If the slide will change. Right, there we go. So PathCrisp, is actually working on various aspects of detection of, I think this is looking at salmonella, but it works for all kinds of nucleic detection problems. I think you saw the videos. This is the kind of medtech future that we'd like to build at CRISPR Bits. This is patented, so now I can show it to you. It's actually a microfluidic device with it's electrowetting, so it actually has an edge computing layer below it. So this will eventually be a chip that can detect up to maybe 50 different nucleic patterns in one test, and have edge computing in the chip, so it can do the optical scanning, it can connect to the cloud, etc. And so this is where this would really have impact and scale once it gets ready. I think we're entering this whole area of tech bio now. I think we talked about it in the previous session as well, but the application of engineering to biology, and whether it is reading genomes or writing genomes or programming them, or eventually also delivering biological material, we seem to be right at the cusp of something that's very exciting. And I think we talked about this at the Science Gallery the other day when David spoke, and we had the panel discussion, but this is India's time. to really think about how to leverage this superconvergence. And of course, I think people are all talking about this. I won't belabor it, but of course, we know that there have been breakthroughs with, AlphaFold and all kinds of new applications of AI into several aspects of biotechnology. This is the vision. I think, can we actually create something like a microbial repository around which we can build multiple application streams? We are calling this Bio-convergence pioneering, and that was launched at the gallery with David's talk there, and and look forward to working with several of you on this. That last slide was just to show that there is an ecosystem here. In fact, this is my personal sort of deep tech ecosystem of startups and institutions and that I've been working with, and we certainly, I think we're positioned to really make something like Bio-convergence pioneering a success, and invite all of you to join in. So that's where the phoenix will rise again. Okay, thank you.
I actually took that word from your email to the secretary ITBT, so I'm not to be blamed. But yes, I mean, we want him, not just phoenix, I think, to continue to do what he has done, and just look at the ecosystem that he has built in the last 30 years. Okay, so that's the array we have. I would start with the first query is, and I think it's 2 rounds, and after that we'll open it to you. And I'll start with Geeta. Tell us about how do you, so the operative word being scale and impact. From your vantage point, how do you see scale and impact? Of course, you can spend some time on Niramai, what you do. And what do you think are the things that come to your mind when scale and impact are?
Sure. First of all, it's great to be on this panel. Thank you, Satya. And I just have to say that I was just still at IISc when Professor Vijay and the gang of 4 that he mentioned, and really the 4 professors stood out among all the thousands of professors there. And
correct. I forgot to mention, Geeta did her PhD from IISc.
Yeah. Anyway, so that was so nice to see that thing. So coming to the question, or before that, at Niramai, we've developed a new method of detecting breast cancer using AI on medical images, particularly a new type of imaging called thermal imaging. So we just measure the temperature variations on the chest and convert that to a breast health report automatically using AI and machine learning, deep learning, and all the good stuff. So having said that, today we have just entered into 20 countries, and we are probably one of the very few startups which have got both Europe and US clearances for an AI as a medical device, software medical device, as we say. Okay, so when Satya mentioned about scaling, impact, and of course health tech, 3 things came to my mind basically. One is, for scaling any medtech innovation, we need to build trust in the patients, trust in the doctors, and also the channel that takes us to the patients, etc. It could be government or corporate and so on and so forth. So how do we build the trust for a medtech device? That is what I very, very deeply feel is through scientific evidence which is trustworthy. That is, there's so many clinical study rules and processes set up already for the drug industry. We will need to kind of adopt a similar systematic, prospective, blinded, randomized control study kind of a thing, multi-site if possible, multi-country if possible. So higher the evidence that we create that your device works as well as the current standard of care or much better, that is the only way to get trust. We see many pilots happening. Oh, I did it on 100 people, we found it. That's all fine. These are all very incidental and examples. But unless we have these systematic studies done, and of course published, because I was talking to a government person and said these are the sensitivity, specificity, wonderful values and so on. I said, I don't understand this. Who is the sort of the authorized person who has said these are good? So we need to publish this in top journals where we have expert peer-reviewed experts who basically review it and then say that the results are worth publishing, right? And of course regulatory is an obvious thing, otherwise you can't go to market. So the building of trust piece through clinical studies, I think, is one main thing, even to start scaling or start being used. The second aspect, I feel, is generally for scaling any tech-based innovation, and I'm probably biased in saying how AI can be used for medtech. So one is, of course, the technical architecture itself to be scaled. And things that you do in terms of processes, right? That has to be scaled. Initially, I was thinking, oh, what is all this ISO and GDPR? I mean, it's so boring, you need to do the process. But trust me, though we were forced to do the ISO 13485, it helped us build the scale in the processes, so we don't have to really run around and make sure all the people are talking right way and so on. So the process helps you make not just the technical architecture cloud and all the good stuff, but also the process of delivering to the customer being scaled and so on and so forth. And the last bit of business scaling piece is more in terms of either you do have a huge business development team yourself, or we have a small team and we chose to work with partners who have had more experience doing it. For example, with Chandy's team, Molbio, we have a global partnership to go to market as well. So it could be either direct or indirect channel. But so you have the scaling in technical level, scaling in processes, as well as scaling in going to the market. And the last bit is really in how do we make money, because the point here is about scaling an impactful innovation. So we want to be able to reach, at least my vision is to reach every lady on earth and stop deaths due to breast cancer. It sounds audacious, but I feel you can stop deaths due to breast cancer if we are able to enable a stage 0, stage 1 detection of breast cancer itself. And that is possible only if you can make this screening test possibly done every year or at least every alternate year to every lady on earth. And that requires the cost to come down so much that probably somewhere it may even hit your own, the price to come down so much that it hits your costs of making it itself. So you need to have some kind of differentiated pricing level, so you're able to offer the solution at a price point of, if you're doing lakhs of women, we can actually offer it at 25 rupees, whereas a mammogram is today offered at 3,500 rupees. So 100 times, impactful cost cutting can be done. But how are we sustainable with that? One, of course, is the volume. Second is we came up with this differentiated pricing for differentiated information. Okay. So we have different types of, for example, patient reports. In a hospital setting, we give full detailed report with markings, images, scoring, everything. Whereas when we actually want to work at really scale level, we just give a triad solution, it's just what is needed at the end of the day in the rural areas, where you can bring the right people to at the right time to the hospitals and so on and so forth. I'm just sort of cutting short all this given the interest of time, but these are the three main things that just struck me when you said scaling, medtech, and of course impact. And the last bit is the innovation. We need to make sure that while we are innovating, we are creating enough evidence that we are innovating as India. I mean, like Mera Bharat Mahan. So I believe a lot in patenting while selling it to Europe and US. We can debate, people may not agree, but that also helps. Like Vijay sir was saying, 35,000 citations. It's an amazing way of saying we are innovating in India.
Great. Trust, systematic clinical trials and data. We'll talk about data because Vijay said, Strand is the first AI company. So we're going to talk about data from India. How do we have the cost advantage in 10, 15, 20 years? Would we sustain that? We'll talk about that a little bit. I'll just do a bit of a puzzle for the panelists so they know who's going to have the last word. I'll shift to Anurag now. and then I'll shift to Chandy, and then to Vijay. I've given you, and then Laina will have the last word of the first round. Okay. So Anurag, you work with the School of Biodesign or Center for Biodesign at Stanford, has been very instrumental in seeding biodesign across the world. How do you, when you train biodesign fellows, when do they start thinking about scale? Okay, and is it a reality only later on or do you induct them into thinking of scale very early on? What has been your experience?
Yeah, I think that's a great question, Satya. And the answer that I'm going to give is informed by 3 of my experiences. One is at J&J, where I worked in developed markets, building devices and medical technologies for the global north, I guess. Second is the biodesign work, of course, that you talked about. And third is PATH, the work I did at PATH in building technologies for global south, for LMIC settings. The training that we do in biodesign, it's needs driven. And often, it's seen as a linear thing where you do unmet needs finding and then you come up with concepts and then you systematically build the product and then you bring it to market. It's actually not linear. It's actually more cyclical and iterative in many ways, actually. And so you need to start thinking about, and this is what we do with our innovators, especially in markets that are not well developed yet. Because in developed markets, if you have an unmet need, a clinical unmet need, the likelihood of that becoming a market unmet need is also very high. So you don't need to worry as much about it. But if you're doing this in India or in South Africa or even China about 15, 20 years back, you really need to worry about whether clinical need is also translating to market need. So that's actually a really critical training and something that we've been doing in India. So we started the India program in 2007. First 8 years, we just trained innovators. They came up with technologies. And we realized very quickly that these innovators hadn't been thinking about the scale in the same way that we are talking about here. So we started working with them. And there are 7 or 8 barrier buckets that you see in markets that are not developed that you need to be training about: the talent, the infrastructure, the training, these different sort of buckets that you need to train them on. And so that has become a part of the training that we do. We've done what is called Founders Forum, and Cure.ai is part of that, and there's other companies. And what we have seen is that once you start making them think about scale from the get-go, from early stages of product development, they avoid many of the mistakes that new innovators tend to make. So that's actually a very critical element of training that we do now.
Thank you, Anurag. Exactly. I mean, we are training. To the panel, Laina has been an entrepreneur first too. And most of them have had an academic touch as well. By the way, Bigtec also at some time was within the boundaries of IISc campus. And we trained startups and innovators, perhaps without even, they have the hammer and they think that everything should be a nail somewhere, right? This is where I want to bring in Chandy. The product that Bigtec did is now in 81 countries. Okay, and this is a proprietary product. It's PCR, as many of us heard during the COVID times, on a ceramide chip. What do you think, Chandy, from the vantage point you had 7 years back or 10 years back to the vantage point you have today? With, of course, we are, Bigtec is a Molbio company, got invested from Temasek and Motilal Oswal. Temasek funded $87 million. That made Molbio a $1 billion company, a unicorn. What's your take in the last 10 years of seeing this, of your own journey?
First of all, Satya, I don't think anybody can be your boss. You are the boss man in this room. So, small correction to that. I've been incredibly fortunate to work with people like Satya, Vijay, Geeta, so many others in our ecosystem, but it's nice to see so many of them on the same panel. We started Bigtec 25 years ago to date, I think. We just finished 25 years. And our mission at Molbio remains the same as the mission that we started off when we started Bigtec. That is to enable diagnostic-led therapy and enable a rapid return to wellness and do this at primary care levels. If you look at India, India is the capital of every known disease that you can think of, whether it is infectious, whether it is metabolic, whatever. Correct? So there is the market opportunity. But all of this market opportunity is extremely fragmented. The biggest consolidator of this market opportunity is public health. And to get into public health, like Geeta very aptly mentioned, you have to generate mountains of evidence. And you have to actually create something like a WHO approval, and WHO does not actually approve too many products. It's only a handful of products. Or you're required to get a US FDA approval or something at that level where the world can trust your product. 10, 15 years ago, let me just switch to 2010. By 2010, we had a PCR that could actually run with clinical samples in any setting and produce results in less than 1 hour. And during H1N1, which all of us forgot about, 2009, when we had H1N1, there was no way that you could get an H1N1 test. People were dying in hospitals, and people were calling me up and asking me to run a test on a platform that was not even completely ready. Okay, from then to today, the amount of evidence that we have generated on our platform has been humongous across countries, across, I think, hundreds of thousands of tests. And that is what it really takes to create enough of evidence to create impact globally. And I think that as a country, we still have some way to go. There is a lot of effort happening now. We have a WHO collaborating center in Vizag. We have a lot of things happening in this country today. But we have to generate that kind of evidence. We have to build in India, and we have to build for the world. If we can build in India, I can guarantee you that the world is our market. If we can build those kind of products. Yes, it takes a lot of effort to go beyond thinking of innovation. As innovators, I think, as an innovator myself, for me, the innovation is the most important. But the biggest thing that I have learned in my 25 years is to give. If it is your baby, let that baby fly. The more you hold it close to yourself, the more it will die.
Is this what you are aligning what Vijay ended his talk by saying, the gang of four embedded in Reliance, so that there has to be a commercial arm?
Absolutely. I think there has to be a commercial vision for a product. Your early innovation is just your early innovation. If you have done your homework right, you would have possibly built something that has potential, but that potential has to be unlocked. I'll stop there.
Great. Thank you. So you can all say, everybody is saying data, trust. Do we have the capability to generate data now in India? You know, clinical beds, clinical testing sites, all of that. Maybe we won't have time to discuss. I'll just take that thread what both Geeta and Anurag and Chandy just mentioned to park it with Vijay here. And Vijay, if you had to do something different, if you had to start Strand 2024. I'll just pause there. You know the question. What should you do?
I probably wouldn't start it.
You don't start it? Let's take a more optimistic view. Okay. Let me say that if you weren't a professor in IISc and still wanted to do that, would you start it?
No, but jokes aside, I think I think what was exciting about Strand was that biology was just getting into its fourth paradigm, right? I think, for those of you who don't follow what that means, science has gone through several paradigms, right? So you have empirical science, theoretical science, computational science, and then data-driven science, right?
Correct.
And so biology was beginning to enter the fourth paradigm of science, and it was a great opening for data scientists like us to actually think about stepping in and making a difference, right? Of course, we started it with an academic bent of mind. How do we actually contribute in computational biology? And then found that a lot of computational biology problems that were being looked at in academia actually were academic problems. And so we started consulting with companies, and that actually got us to understand better what exactly was needed out there, and that's how we became confident about actually launching a company in that space. Today, I think it's a very different situation, and if I were to start something like Strand, I think there's so many exciting things that Strand is doing as well. It seems like that the innovation potential is just still enormous, and I think. It's certainly what I would do today if I was starting out in the space of genomics is build a sequencer, right?
Okay.
I actually think India needs a sequencer, right? If you really want to make a difference and be Atmanirbhar, I think let's start with that sequencer, right? And that's the capability and the bioengineering skills. I think we have that now. Nano, whatever you need, we have that now, and that's what I would do.
Absolutely. Oh, wonderful that you said that. And before I go to Laina, and then we go a rapid fire round, and we'll open it up to you. When we built INS Vikrant, or I think one of the warships, 80 or 70% was from suppliers from India. When we say we want to build a bullet train, and somebody may argue why a country of $3,000 per head wants to build a bullet train, I think this is what Vijay is referring to. The kind of complex projects you do, you start skilling the whole society around that, right? And getting that. We'll pause there. Laina here, she's just, I won't name names, but she's just closing a funding round of $5 million in the last, hopefully in the next 2 to 3 weeks, fingers crossed. I've seen Laina since her very early nascent days in BrainSight AI. So, and it's also an AI company that, says AI at the end of the company's name, right? How do you see it, Laina, in terms of the next, what you have gone through in the last 5 years, and how do you want to scale? How easy it is to get your 5 million?
Not at all. First of all, I want to thank you for inviting me here. A lot of the people here I am with are people I have really looked up to over the years. So Professor Chandru, Dr. Geeta, all of you have been people I've looked up to and learned from. So I'm going to go backwards on your answers. In terms of answering the question of how easy is it to get to $5 million, not very easy. I think from the very beginning, what was drilled into us, and I think India and in general, there's this whole startup ecosystem of accelerators that we've been part of, and especially during COVID when nothing else was working for us, we were part of a number of accelerator programs who drilled into us the idea of thinking scale from the very beginning. So to give you a sense of what we do, like Dr. Chandru, we are building a platform for connectomics, a kind of omics which is about looking at the functional connectivity and structural connectivity of the brain. And it has a vast number of uses in medical, non-medical, and so on. Now, we started with looking at medical, and that was the toughest because building a medical connectomics, as Dr. Geeta said, was you had to think about CDSEO, you had to think about ISOs, you had to think about FDA, and the kind of accelerators that we were part of. We were thinking of FDA from the very beginning, and it was like, and none of us had experience in it. My co-founder was a scientist who had just completed a PhD, and I had come from a background of thinking scale always, so I had done operating system design and always thought of technology at scale. I had worked with public health and so always thought of healthcare at scale. I had done an MBA and so thought of business at scale. So when the two of us came together, we had complementary skill sets, but no idea of how to build a medtech company, how to build trust, how to do ISOs, how to even think about FDAs. All of that was so new to us, but we persevered, and I think the idea that this is such a powerful technology and that it's being built from India, and we are one of 2 worldwide companies doing this kind of work. So the fact that, as my mother used to say, if you aim for the moon, you'll at least reach the rooftop, right? Like, so we aimed to be the 2nd worldwide company to get FDA for medical connectomics. And we are getting there. And so when we kept our scale high and when we kept our ambitions high, we somehow managed, the whole team, all young people, really young people with stars in their eyes, who are figuring out how to do each of these steps. It has been incredible, and I think, the more you achieve, the more people expect scale of you, so you just kind of keep building on your scale always, so yeah.
Great point. Okay. We have 15-20 minutes left. I really want to open it up. But before we do, the 3 questions, the panelists can pick. Multiple choice question is, they probably have done that all before they got into the JEEs and engineering. They're good in MCQs. The 3 questions is 1, and each of you can take 1 or 2 questions to answer, but please be brief. Do you think India does the science of tomorrow? Okay, number 1. Number 2 is, if India does the science of tomorrow, do you think those people who are doing the science of tomorrow want to partner with you? So how does academic industry partnership look to you? I've been helping Chandy to do that. Third is, almost all of your companies have become big, at least 2 of them are really big. The others are in the process of becoming big. How do you offer things to the growing startup network here as a platform yourself? So things like Accelerator or the Edge program that we did, Chandy. So those are the 3 questions. Do we do the science of tomorrow today in India? If we do, are those people who are doing it happy to partner with you all? So let me start with Vijay, then I'll go to Anurag, and then Chandy, then Geeta, then Laina. If Laina complains, then I'll bring her in between. Okay.
Yeah.
Go ahead.
Yeah, no, I think, are we doing the science of today and tomorrow, right, in India? Oh, sorry. Are we actually at that edge of science and technology? I believe we are. I mean, there is absolutely. I think, we're certainly there in academia, right? We are. I think the bridge from that cutting edge in academia to commercialization, to enterprise, to industry for that impact, I think still needs to be built. And I think this was discussed in the last session as well. And, and I think Vikraman had this idea that, we should think about the 1,000 sequencers kinds of CCamps, right, all over, or IKPs, or, and how that would, create that translational edge. I think, I spent sabbaticals at places like Stanford and so on, and it's incredible how the research in the institution gets almost immediate feedback from the industry around. right? So I was at the information systems lab, and every few weeks there would be an interaction with the CTOs of, Facebook, Cisco, you name them, and students, PhD students and faculty would be presenting what they were working on, and someone from the audience would say, well, tweak the problem a little to go in this direction, and it will have impact, right? And so that quick sort of interaction between industry and
you think that lacks here in India now?
That we lack.
How do we change that? TDOs?
Well, I think it has to come from within. It's right now there is, the question is what is the incentive within the universities to move in that direction? But I think just having CCamp in NCBS has made a difference, and Mukund and I were talking about that earlier. Having, SID and, the Gang of Four, interacting with ISC has done that. I think it's an evolution, but it's happening. But I think and I remember talking to Eric Schmidt about this a few years back at one of the conferences that attracts investment into the US, and he said, the reason why the US has been such a leader in innovation is the higher educational system, right? And how that has become sort of the hub of so many extraordinary innovation clusters, right? And that, actually, it's not been repeated in too many other countries. I still think the US does it so much better than anybody else. And of course, we have Anurag here, so he can expand on that. But I do think we have not unlocked that potential, right? And that investment that we've made in the higher educational system. We have an incredible pool of talent sitting in there that can do extremely impactful work. But
so you
we
think
have to
there's
unlock
less
that.
of an ivory tower now? Sure. Okay. Anurag, Stanford, go ahead, battle on.
Yeah, so I'll build upon what Vijay said. Let me just do a quick show of hands. How many of you in the audience think that India does not have smart people, or enough smart people? How many of you think that we don't do science that is leading edge that could be useful for humanity? I don't think we'll see some hands, of course, and I think some of you are right about that. I think we need to do more of, because the incentives are just not there. And I think what Vijay talked about is the fence that is there between academia and industry. There's another fence I want to talk about, and that fence is in the pipeline of innovators. So you have a lot of innovators right now in India that are trying to create startups. They are sitting in academia, they're sitting in incubators, and they're building these small startups that will scale. Some of you have actually really scaled significantly, but most of you haven't. And I worry about this pipeline jam that you would have if a vast majority of these companies do not scale. So you got the innovators, you got startups, you got commercial stage startups.
Vijay and I say that as a graveyard of prototypes, but with a more positive outlook, right?
Yeah. So I think what is missing in India right now, and China, I've dealt with this about a decade back, is this fence that sits between startups that are commercial stage or early commercial stage and startups that can become as big as Strand Life Sciences. And we need to really open that up. We need to find a way to bring large companies like Strand, but also large companies like Pfizer, large companies like Medtronic to India, make sure that innovation ecosystem is complete. This is what happens at Stanford and at MIT and other places. The companies actually come to these startups, and that fence doesn't exist. So that's actually one comment I would make about, it's not just so much about encouraging more science and more technology development and creating more startups, but also making sure that these startups actually see the light of end of the tunnel, and that's what scale and impact is all about.
Thank you, Anurag. Brilliantly put. So, Pfizer's and Microsoft launchpads, or Google launchpads, Molbio and Bigtec also tried doing something last year called the Edge, but I don't want to force Chandy to just focus on the Edge here. Chandy, we have started working with lots of academic entrepreneurs, right? Where do you see what can be done more, and by whom?
Satya, in answer to your first question, I am a little more pessimistic than Vijay is. I don't think that we are doing enough cutting-edge work. I think we are satisfied with low-hanging fruit.
So when Anurag asked that question, Mukund raised his hand. So I think you have
about 20% of the people.
You have company there in those thoughts.
The reason I think that we are satisfied with low-hanging fruit is that we are incredibly nervous about failure. And that failure in academia, failure as an entrepreneur, it's something that we are socially not geared to face. We don't believe that we can rise like the phoenix from the ashes of failure. This is something that I think we have to do something about. There is a reason behind this though. The reason is that you are likely to fail as an entrepreneur, primarily because your ecosystem is not mature enough.
Correct.
Simple things like getting two pieces of plastic together, making something happen in those two pieces of plastic. You can prove that in an academic lab. You try to manufacture that in this country, it takes an incredible amount of time and energy, and it is compounded by people who are not willing to tell you upfront that the method that you are adopting will not work. So lack of expertise is a huge problem. One of the reasons why Satya and I thought about the Edge program and was precisely this, we have to look at our functional prototypes very early and decide whether they can scale, whether there is a design for manufacturing, there is design for scalability, there is design for serviceability. Okay, many of us are all focusing on point of care. I think that is the flavor of the day, but let me tell you that if your device is in the middle of a wildlife sanctuary and it has to work, it better work, or it has to be easily serviceable. But we don't think of some of these things, isn't it? We are today building a $4 million center of excellence in engineering precisely to address this gap. Because it is not that we don't have facilities. IISc has facilities, IKP has facilities. But I believe that the industry has to also put a foot forward and say, here is what we have learned. This is the mistake that our co-travelers should not make in this journey. And this is the way that something like this can be translated. A combination of skill and facility is absolutely incredibly important for this country. And this collaboration with academia, also I have, maybe I'll get beaten up for this, but I think academia does not understand scale at all.
Say that again, sorry.
Academia does not understand scale. Academia think that they understand IP, but they don't understand that if they hold IP so close to them and demand so much of the IP that they create, that IP will not create impact. That IP will not scale.
One of Vijay's famous statement is the value of an IP is like banana, right? Self-life of a banana, right? So very well pointed. And I think what Chandy mentioned about capabilities, vendors, suppliers, their capabilities, and plus working with academia. I think this is an evolution. Hopefully the evolution that we have seen in the last 10 years of now seeing so many innovators. I mean, 2004, Strand started, right, Vijay? I think he was possibly the only one of rare, he was the only one. Now, when we started BIG in 2012, it's the biggest, the early stage fund for BIRAC. If you go into the same campus, there must be at least 2 dozen to 3 dozen professors running their own company. So there is a shift. But what Chandy said is correct. I mean, the views, how do you work with academic institution? What is their view of scale and be able to commercialize through an embedded system like Vijay mentioned, or Reliance or us, Molbio and others. I'll pause there. I'll shift to Geeta. Geeta, I'm itching to put you on spot, but I wouldn't. I wanted to talk about how do you see small companies, not small companies, I don't want to categorize you as a small company, but small companies, big companies partnership. So, the others have pointed on that, other questions out of the three I had asked. What is your take and how should we go forward with that?
First of all, great points, Standy. Actually, I was want to just clap for everything you said, and of course, same with others as well. And the key seed for your question, right, is you asked the first question of does India have enough capability? I will put both my hands up. Yes, I think we have excellent science institution, my favorite IAC and several others. They can build, etc. Can the same idea or a prototype or a small startup become Medtronic, Philips, GE from India? I think that's one solution is what you mentioned.
Yeah.
But here we have several difficulties today. Many of the points Chandy raised with respect to the ecosystem, vendor ecosystem, partnering ecosystem, etc. There's also I don't know how many of you understand Kannada. There's saying, Hittala gida maddalla, means if you grow your medicine in your own field, right, it is not good enough. So I talked about the trust building part of it, right? There is this huge amount of suspicion of anything that is built in India to be used in India. I'm very actually pained when saying this. You go to a hospital, use this. Here are the complete results. All of that. I don't think our clinical ecosystem or people who are actually practicing clinical practice essentially can understand these papers, understand what sensitivity specificity means. There is a lack of understanding of the metrics that are valued everywhere else. Correct. That is one part, right? And just when, in a couple of years ago, when we actually got the US FDA clearance, then the same people thought, oh, this is worth it, and then started, adopting it. So that means unless somebody outside India blesses this, there's still sort of, suspicion on what we build. I mean, it's not just for medtech, it's true for HP and other places.
That's a journey of the country. I mean, Japanese products in 60s and 70s.
Yeah, if it is, unless it's used in Germany or US, it's not worth using in India.
And when I see German roads with Kia cars, I think, hey, you know what? South Korea has made it now.
Yeah, I mean,
so
it's crazy. So has anyone else in US used thermal imaging and AI? No, we are the first people. Then I have to say, we have 13 US patents. We decided to do US patents so that they know it is actually. So this kind of, unless somebody else blesses it, I can't use it, is one thing I get really pained about. It's nothing to do with medtech. I've been in HP earlier, long multinationals. So I used to directly go to the head of the department in US, get their feedback, and then I used to get funding for a project in India. So this is something we know, right? So this is one aspect I wanted to bring in.
Yeah.
And to get rid of this or get over this, yes, maybe partnership with bigger organizations, like you mentioned, to climb on the ladder that they have already done with 25 years, 30 years, we are seeing stalwarts here, is definitely one way to scale and reach. As long as big fish and small fish issues don't happen, right? We need to keep the identity, and we should not lose the vision that we have for the small. And the last bit here is also the funding ecosystem. I think we had Dr. Anurag talk about funding piece, right? Which is also the same case. You go for Series A, Series B. We've raised enough, good enough funding so far, but then when you want to scale, you need larger funds. Then US investors really like what we are doing, but you're an Indian company. Why don't you swap and become headquartered in India? Sorry, US. So there's a lot of these issues we need to solve. We need to have more risk risk-taking investors as well. There's always risk versus reward, graph, and I think a lot more needs to develop from an ecosystem standpoint. But can we build wonderful deep-sized prototypes? Yes, yes, yes.
Okay.
How does it scale? A lot more to be done.
Great points. I think, big fish, small fish, capabilities, all that. And of course, the brand image of Indian products, right? By the way, design thinking didn't start, people like Braun, companies like Braun in Germany were thinking about design thinking 100 years back, right? Or JICE for that matter. I think Vijay was itching to say something, but Vijay, if you can be brief, then and then we can go to Laina.
Okay.
And then we'll end it.
Just very quickly, I think one gap that I see, and I think which is easy to fix, and I really hope we can do that quickly, is today when you go out to get a valuation for your company, let's say, Geeta does that, or Laina, the merchant bankers in India who will do the valuation will do a revenue-based valuation. Okay, because that's the only thing they know, right? They'll say, what is your projected revenue? They'll discount it and then put some value on your company. What we need is asset-based valuation. And to value physical assets, all these accountants know how to do it, right? But to value intellectual property, right, or intellectual assets, it could be trade secrets, they could be, patents, they could be all kinds of intellectual assets. We just don't have that ecosystem, right? And you're not going to get risk capital coming in and, supporting innovation unless you actually have a reliable way to assess, what that IP is. And again, this goes back to Chandy's point that, maybe some of our academic institutions just need a little bit of truth serum, right? about what is the true value of those patents and so on that are held, and I think that needs to be done. And I'm sorry that David has stepped out, because he is one of those people who values innovation for investors in the US, right? And he understands how that process works, right? And so you just need people who can track. We have patent lawyers now. We have Kumaran and Sagar, Malti. There are lots of people who are following patent ideas pretty closely, but we need to also make them into valuation experts.
Correct. So, thank you, Vijay, for that. Laina, go ahead, Laina.
Well, I think I actually resonate a lot with Dr. Nair on the fact that I think the reason why we've scaled how much ever we've scaled right now, I think there's still a lot to go, is because we are two people with very complementary skill sets. So my co-founder is a scientist who thinks about the patents, who thinks about the science, the deep technology, while I'm the commercial person, and when I don't understand why a patent, why is it so limited? What will you think of, how will you actually think that it goes to scale? If it doesn't make commonsensical sense to me, we get into a lot of arguments about what is this. And I think those arguments, those open conversations, and I learn a lot about science and tech from her, but she learns a lot about commercial from me. And I think the two of us, when we come together, is when we actually build something which is meant to scale. Otherwise, we would, if we had only focused on the initial patents that my co-founder came in, we would have been limited to a very, very small market, a very small problem. But I think everybody around us and the fact that we have this very good complementary skill sets between the co-founders is what actually helps us think much larger than any of us could have individually.
Thank you. You have two people in a room and you are there. One is our Honorable Prime Minister. The other one is Bill Gates. What are the 3 things you'll ask, or 2 things, or whatever? Well, let's start with Laina again. Laina, quickly.
Really, you put me on the spot for this one. Okay. To our Prime Minister, I would ask...
and maybe Honorable Finance Minister also next to him. So,
absolutely. So I would ask them to actually build programs that work with venture capitalists to de-risk even venture capitalists who are looking at high innovation.
30 seconds over. Thank you very much. Geeta?
Is going to go in the same direction. So Mr. Bill Gates and Mr. Modi create a fund which only funds Indian startups going to US.
Okay, great point. Anurag?
To Mr. Modi, it'll be make sure that there's a policy framework to procure technologies that are born in India for Indian needs. So that's number one. And to Bill Gates, remarkable innovations happening in India, use it for the rest of the world.
Lovely. Thank you. Chandy?
To our Prime Minister to use his global stature to help India create a regulatory system that is applicable throughout the global south so that the world is our market. And to Mr. Bill Gates to be a little more kind to entrepreneurs. He was an entrepreneur himself. He sets very tough goals for entrepreneurs nowadays.
Wonderfully put. Okay, Vijay, 30 seconds.
Right, yeah. So to the Prime Minister, again, I think it's already been mentioned, but I think we really need to rethink our procurement policies, right? And you know, we're starting to do it in defense, but please think of biosecurity as a national security, right? And let's start thinking about investing in innovation and also being clear about procurement policies on innovation so that, you know, because really to drive innovation, you need the military industrial
Bill Gates?
complex, right? Yeah. And with Bill Gates, I think, you know, you do a lot of grassroots support, but, you know, you don't support innovation. That in India, right?
Great. So I doff my hat to all of them here. They've done wonderfully well for this panel and for their professional careers as startups. Big round of applause. That's really not big. Yes, thank you very much.
To stay informed about the startup ecosystem, subscribe to My Startup TV.